Hello everyone and welcome to BoardWalk. Today we will be covering the lysosomal storage diseases, a group of complex disorders that pose diagnostic challenges due to their complex biochemical pathways and diverse clinical presentations. But don't worry, we'll break down these diseases and help you remember them with our visual mnemonics. To begin, lysosomal storage diseases are a group of rare, inherited, metabolic disorders caused by defects in the lysosomal functions. When specific degradation enzymes are deficient, substrates begin to pile up in the lysosomes of cells and cause a variety of problems. Majority of these disorders are autosomal recessive, but a couple are X-linked recessive, which we will make clear in our images. The diagram at the bottom shows the biochemical pathways of the relevant substrates and enzymes that lead to the production of ceramide, a bioactive lipid at the center of sphingolipid metabolism. This may seem complicated, but our images should help you remember the most important points so you can get some easy points on test day. Let's start with our first class of lysosomal storage diseases, the sphingolipidoses. Alright, so the first lysosomal storage disease we will cover is Tay-Sachs disease, and we will title this image Tay versus the musculoskeleton boss. Here we have a young rebellious boy named Tay who is playing a horror game called Hyperflex. He has Tay on his hat to help you remember Tay-Sachs disease. He's very young and shouldn't be playing such a scary game to begin with, which helps you recall that this disorder presents in infancy with developmental delay. His ears are huge and on backwards for some reason, which signifies hyperacusis. This presents as an infant having a startle response to loud noises. Looking at the skull boss in the video game, we can see that he has bright red eyes. This signifies the cherry red spot seen on the macula, which occurs due to lipid accumulation in the ganglion cell layer of the eye. The skull's brain is exposed, signifying the neurodegeneration that occurs in these young patients. Also, look at the skull boss's bulky, flexed biceps. He's clearly been hitting the gym and getting his protein in. This, along with the game's name Hyperflex, should help you remember that Tay-Sachs patients have hyperreflexia. Now, let's move on to biochemistry. At the bottom of the screen, we can see that Tay is on his second life in the game, hence Game 2. This should help you remember that GM2 ganglioside is the substrate that accumulates. Also, look at that cool hexagonal wall pattern. This represents that hexosaminidase A is the deficient enzyme. Remember, hexagonal wall pattern, hexosaminidase A. Now, moving on to histology, look at those onions on the table. Tay may have little regard for ESRB game ratings, but he does not skimp out on his veggies. These onions signify the onion skin appearance of lysosomes on histology. You should look up a picture of this to familiarize yourself with it. So here's a summary slide covering all of these points. I hope that this first image helped you, and let's move on to our next visual mnemonic. Now we will cover Fabry disease. This image takes place in a busy shopping mall with our fabulous Queen Fabia and her chore boy. Hence, it is titled Fabia's Fabulous Bizarre Day. So she knows she's looking fabulous, which should help you remember Fabry disease. We can also see her thoughts, and look how fabulous is spelled, with an alpha and an A. This may seem like a bit of a stretch, but it should help you remember that alpha galactosidase A is the deficient enzyme. This is the only enzyme out of these lysosomal storage diseases that starts with an alpha symbol, so it's a good differentiating factor. Moving on, look at her purse with a gigantic trihexagonal emblem on it. Remember that this is 3 hexagons to recall that ceramide trihexoside is the substrate that accumulates. This gaudy emblem also embellishes a super expensive brand, XLR. This signifies that the disease is inherited in an X-linked recessive pattern. Let's move on to the clinical presentation of this disease. We will represent the classic triad of symptoms with Fabia's chore boy, Fabio. His shirt is covered in red polka dots, representing papular skin lesions called angiokeratomas, which occur due to capillary malformations. Next, he is holding an empty water bottle, which represents hypohidrosis, or low sweat production. Lastly, he is a young man using a cane. This represents early peripheral neuropathy. There are also some late manifestations of Fabry disease to be aware of, including cardiovascular disease and progressive renal failure. This is shown with the mall advertisements telling people, have a heart, donate a kidney. Here is a summary slide for your review. I hope Fabia's fabulous day at the bazaar helps you remember these important points about Fabry disease.